The HSE say more chronic illness must be managed in the community. It's better for patients and takes pressure off hospitals, the essence of primary care. But when a leading public hospital devised an outreach programme to achieve just that, it was refused funding to expand. Instead, the HSE outsourced to a private company, but then didn't renew the contract, leaving patients confused. Now the HSE has stepped backwards to embrace the original public scheme. What is going on? Michael McGloin is someone who would benefit greatly from home-based care. He lives in Sligo and suffers from COPD, chronic obstructive pulmonary disease, a condition that affects breathing, and after chest pain is the most common cause of hospital admissions through A&E.
Flare-up is very frightening. You start gasping, so the only thing you can do is call your GP, and he normally will refer you to the hospital.
And how frequently would you go into hospital?
Well, I normally have anything to 3, it could be up to 5 admissions a year I could have.
And how long would you be in for?
I'm normally in for about up to 10 days.
COPD is a condition that must be managed in the community if our health service isn't to buckle. For Michael, with his 50 days a year in hospital, is just one of many.
COPD patients take up about 80,000 bed days per year. And when a patient gets very breathless, it's normally caused by an infection, a severe infection. Now, if it's very severe, which most times it is, you're referred to hospital and you have to go in there, and you can be there for anything up to 10 days, and you're on the hydrocortisone again, on steroids and other medications.
And would you rather be looked after at home than in a hospital?
Oh gosh, yeah, any patient will tell you they prefer to be treated at home.
Michael McGloin is campaigning to have an innovative but so far Dublin-only care programme extended around the country.
Oh, how are you doing? Hi, Michael. How are you? Great to see you.
The scheme involves hospital staff visiting COPD sufferers in their homes.
I'm just going to check your oxygen levels, if that's all right with you, and we'll see how they're doing.
Michael Coyle from Rathmines benefits hugely from it, and now spends only a fraction of the time he used to spend in hospital. By bringing the hospital into the home, this approach adds a new dimension to community-based primary care.
And you have the oxygen going through that then as well?
Yeah.
Okay.
It was devised by respiratory specialist Finbar O'Connell and his team at St James's Hospital, and has reduced hospitalisation periods from over 10 days to just 1.5 days.
That has a massive impact on what is an extremely common cause of acute admission to hospital. Massive saving in bed days. That is obviously very good for the hospitals. It's also very good for the patients, because patients back in their home environment, not exposed to hospital-acquired infections, which are a real thing. And obviously this was a very effective model for getting patients home.
Not only did the programme get patients home 9 days earlier, it reduced their readmission rates by an astounding 75% through intensive management at the day centre and a programme of education and exercise. Not surprisingly, it won a major award.
So how many times a week are you walking?
Minister Harney was the guest of honour when our programme won the Best Hospital Project in the Irish Healthcare Awards. Minister Harney knows that this is innovative. This is real innovation delivered by Irish public hospitals. So why do the HSE not just fund it? Okay. Need you to come back.
Finbar O'Connell did seek funding to expand his programme, but the HSE had already decided to go private. Last year, a company called Tara Healthcare was contracted to provide a hospital-in-the-home service for COPD sufferers. And during the year it treated over 1,400 patients with various conditions in their homes. However, after an independent review, the HSE decided last month not to renew the contract. The unpublished review reaches disturbing conclusions about the HSE's own oversight of the operation.
The report is openly critical of the decision to go to the private sector. It says that that was badly planned. There was no really well thought out plan in terms of contracting this for the private sector. And I think that's very honestly and openly stated, and I think the HSE will learn from that. This is not like contract cleaning. This is contracting of clinical services, and I think if you don't have a good plan to contract properly for clinical services, it's very difficult to get it right. I don't think they necessarily got it right.
The review found Tara's patients rated the service highly, but said of the HSE that it had no proper business case or clear rationale for privatising the service in the first place. The HSE invested £1.38 million in Tara without getting any security, and the review says it was not clear who within the HSE had overall responsibility for managing the contract. Tara told us they will not be refunding the HSE's money, which went on rent, equipment and recruiting staff, and said the review itself was just a fig leaf to cut costs. The review suggests the HSE may have rushed to the private sector because the public sector was too slow.
It's hard to believe really that it would have been much slower in public hospital services, given that the early discharge programme for COPD was already in existence for over 5 years in 2 of the Dublin hospitals. So it's hard to believe that that's a legitimate reason not to look to expand existing services in the public sector. The thing that's most welcome from the report is that there now seems to be a willingness to look at the notion of expanding outreach. And at the end of the day, that would be really good for Irish patients. That's what this is about.